Studies show that men in this country are not living as long as women, with higher rates of cancer, diabetes, suicide, and heart disease. NBC News medical correspondent Dr. Akshay Syal takes a look at a new and creative public health campaign designed to help men combat one of those issues.
Picking up new hobbies such as cooking is another manly way to avoid depression and reduce stress.
This is man therapy.
First, mash up 5 or 6 of these green things.
A service created by the Colorado Department of Public Health and Grit Digital Health to help prevent suicide in men.
There's still a lot of stigma and barriers out there that prevent men from wanting to talk about how they're feeling, and it leaves a lot of them struggling in silence.
Dr. Jody Fry, a professor at the University of Maryland, is working with man therapy to help get the life-saving message out there.
Why is it that men are so afraid to seek help?
I think a lot of men feel embarrassed. The term just pull yourself up by your bootstraps is still alive and well out there. And men often feel like seeking help is a sign of weakness.
I'm Dr. Rich Mahogany. Visit me at mantherapy.org.
The creators say nearly 3 million people have viewed the character Dr. Richard Mahogany in the Man Therapy website.
You can't fix your mental health with duct tape. Giving men the tools to help themselves, to let them know that help's available, is very comforting.
Men are 4 times more likely to die by suicide than women. But a recent study funded by the CDC found that man therapy was able to decrease depression and suicidal thoughts in men.
Manly way.
But it's not just suicide. In 2021, the difference in life expectancy between men and women reached 5.9 years, the largest gap since 1996. This is because men are also more likely to die from COVID-19, diabetes, and cancer than women. Some of this could be a result of biology, but there's also some cultural bias.
Men are not seeking healthcare in a preventative way.
Dr. Haider Varaj is a cardiologist and a proponent in men's health at Brigham and Women's Hospital in Boston.
Men are seeking healthcare when they're calling the emergency room or calling 911, and they're coming in for complications for disease.
His approach is simple. We need to rethink how we engage men in healthcare.
They're not looking to a doctor for health information. They might be looking to a podcast. They might be looking to a website. They might be looking to their church or their social group. And so we have to make sure that we engage with all of those partners.
Whether looking at medicine in a new way or visiting Dr. Mahogany at Man Therapy, it's time for men to take their health seriously.
And to learn more about the campaign, visit mantherapy.org. We'll be back right after this break.